What's up, y'all? It's me, Professor D. I have a mental health question for you guys. So here's a question. An adolescent client is diagnosed with anorexia nervosa and discloses an incestuous relationship. Which is the nurse's most therapeutic response? 1, tell me more about what happened to you when you were younger. 2, you'll be okay, just keep on talking. 3, what kind of comfort food would you want tonight? Or 4, can you tell me more about how you feel about what happened? Again, an adolescent client diagnosed with anorexia nervosa discloses an incestuous relationship. Which is a nurse's most therapeutic response? 1, tell me more about what happened to you when you were younger. 2, you'll be okay, just keep on talking. 3, what kind of comfort food do you want tonight? Or 4, can you tell me how you feel about what happened? The correct answer is 4. So what I want you guys to take from this is when it comes to mental health, when it comes to psych, you always want to choose an answer where you get the patient to talk about their feelings. You want them to get it out, because what happens in mental health, such as depression, all depression is anger and aggression turned inwards, turned towards themselves. So the more that you get patients talking and you get it out of their body, that anger, that aggression, all of those bad feelings the patient would be turning towards themselves, right? They're getting it out. So the whole point of mental health and psych is getting the patients to talk about their feelings. You always want to ask an open-ended question, meaning that you want to ask them a question where they can't just say yes or no. They have to actually describe something, explain what they're feeling, go into details. Now, there are very few situations that you're going to ask closed-ended question where it's a yes or no, okay? And I'm going to explain that to you. Number 1, suicide. If you suspect a patient suicidal, you're not going to beat around the bush. You don't want long, drawn-out explanations. You're going to ask them directly, do you have thoughts of harming yourself? Because many times people who are suicidal, they really don't want to harm themselves, but no one's ever asked. So suicide. Number 1, you ask them directly. You don't beat around the bush. Second situation where you're asking closed-ended question, which means you get a yes or no answer, is if you're doing a short history. Patient's just been admitted, you need fast answers. Do you have a history of diabetes? Do you have any allergies? Those are types of questions that you ask yes or no, okay? Third type of question that you're gonna ask for yes or no is when it comes to abuse. If you suspect a patient is being abused, usually they want to tell someone, but they've just never been able to because no one's ever asked them directly. So you're going to ask that patient, are you being abused? Are you being harmed by anyone? You ask them directly. 3 situations where you ask closed-ended questions: abuse, suicide, and assessment, short assessments such as history and physical. Okay, see you next time. Make sure you guys tune in to my website, nexusnursinginstitute.com. Thank you.